So who are you?
So my name's Michael Sears. I'm the founder of 11 Health and a long-term patient with multiple conditions. I've been a patient since the age of 12.
What is the big idea that you are driving that is helping to shape the human story?
So I am focused, and we at 11 Health are very much focused on digitising the medical bag market. Having spent 30 plus years effectively attached to bags almost every day of my life, whether they be IV bags for intravenous fluids, whether they be parental nutrition bags through IV lines, whether they be a stoma bag or a catheter bag. As a patient, I've spent 30 plus years attached to bags that effectively require the continual monitoring of volume output. And our big idea is very simple. Technology can be applied to that space, and procedures and management of those bags that are very time sensitive, they're very difficult to control and manage, could be digitised, and that's our goal.
And when do you anticipate this service launching?
So we've launched our first product, the Ostomy Alert Sensor, which is a connected medical device that attaches to the outside of stoma bags. And we launched that a few months ago, and that is, if you like, stage one on this journey to digitise the medical bag market.
And why has this not been done before, in your opinion?
Really good question. I think, if I'm honest with you, I think it's because we're not at a very sexy end of healthcare. We're really at what I call the down and dirty end, that has really been dealt with in a certain way for years and years and years. You know, you have either a line in a vein, you get connected to a drip bag or a bag, or you know, you have a surgery like a stoma surgery, you have a bag applied to skin, and you just get on with it. And it's always been that way, and it hasn't attracted investment or funding or innovation, because it's just the down and dirty end of healthcare. But as a patient who's lived it for 30 plus years, why should it be overlooked?
And could you take us through your patient journey?
Sure. So I was diagnosed at 12 with Crohn's disease, which is an incurable bowel condition. And that was, you know, a great relief at that time, because it was 18 months of tests to get to a diagnosis. And in a sense, that was my first interaction with a bag. I had my first surgery at 14. I had 25 plus surgeries over the next 25 years, to the point of intestinal failure. So a small bowel that starts at sort of 5 or 6 metres for me ended up at 40 centimetres. I found myself at a London hospital for about 18 months, really kept alive through intravenous feeding, attached to another bag. And then at the end of 2011, I became the 11th patient to undergo a intestinal transplant in the UK at the Churchill Hospital. That was about a 9-month stay to recover from transplant, and subsequently in the last few years, 2-time cancer patient, lymphoma, and so my patient journey has been an interesting one.
What have you learnt from other patients during the course of your journey?
Masses. I think, you know, the greatest underutilised resource in healthcare are patients, and more than anything, you learn what it's like to be in someone else's shoes. Every step of the way, you learn things that no healthcare professionals, no friends and family can really understand or teach you, because you're talking to someone that's experienced very similar things to you. And I think that connectivity, that ability to share, to learn, to ask for help, hints and tips, is the most vital part of healthcare. And I'm privileged now, because I get, the roles are reversed. I get to mentor patients going through intestinal transplant, or newly diagnosed with Crohn's disease or ongoing problems with stomas, I get to sort of apply my learnings to them. And I think that is such a valuable resource in healthcare.
Could you tell us a little bit about how and on what levels you are encouraging patients to share information and experience amongst themselves and with doctors, the sort of practical day-to-day ways in which you're trying to push this?
So I guess my earliest part of this journey was in the build-up to my transplant. So 5+ years ago, everybody wanted to know what it was going to be like going through transplant, where, to be honest with you, survival rates were 50-50. They'd done 10, and 5 sadly hadn't even made it off the operating table. So it led to lots of comments and questions, and all I did was start a blog, really as a way of letting family and friends know what was happening. That blog took off. I found my transplant team reading it because they wanted to know what it was really like from a patient, through the lens of a patient going through transplant, build up and during, the impact it's having on life. They then passed it on to medical students, and so it gained momentum from there. And I think, the greatest gift that blog did was 4 patients from different parts of the world read the blog and went on to have a bowel transplant that their medical teams didn't even know existed, just simply because they were reading about a journey from another patient. And then on World IBD Day, which is always in May, we decided while I was in hospital we'd set up a support group on Facebook. We set up Bowel Disease One Global Family that now has over 1,000 patients connected together. At the time, we got 500 patients within 24 hours literally coming online and sharing their stories. That's led to tweet chats. That's led to connecting about 20,000 patients now around the world, using social media, so no sort of private forums, but just using open access, free tools to connect patients. And at Oxford, we now have a sort of mentoring program for new patients that go through transplant, and I'm one of those that gets the privilege to talk to new patients and their families in the build-up to it. So that's really, that's a huge part of my life.
Could you talk about a couple of case histories where patient-to-patient sharing has helped a patient day to day, or possibly even saved their lives?
Sure. So about a year after transplant, a gentleman in Scotland contacted me and said, I'd read your blog and my doctors had never heard of a bowel transplant. And, I'm a slightly older gentleman and figured my life was basically attached to an intravenous feed, just waiting for things to end. I spoke to him at length. We got on the phone call. I got the team at Oxford to speak to his medical team. 8 days later, he flew down to Oxford. And 6 weeks later, from that point, he had a life-changing bowel transplant, literally as a result of reading the blog. The other end of the extreme is there was a lovely guy and his wife that came to visit me while I was staying on the ward, and sadly he'd been diagnosed with a cancer in the bowel, and it was a very fast-growing tumour, and his only cure was potentially a bowel transplant. But he was scared, really scared, and his wife was desperate for him to have the operation, and it took 2 years of working with him, talking to him. He knew that this tumour was growing, but bizarrely, in his own way, he felt more comfortable with that happening than the risk of going under surgery where you're 50-50 chance of survival. And after 2 years of building a friendship and a trust and talking to his family, he ended up having a transplant and was successful. And it has changed his life. And so one of those examples, 8 days and 6 weeks later, this guy has been having a transplant. The other one was literally 2 years of, I don't want to do this, and eventually it was a success.
Are there any funding issues with these people receiving transplants? That's one question. The sort of secondary to that was, I saw that you raised £250,000 through your charity, which is an enormous amount of money. But do you feel that a certain amount of funds needs to go into a pot to actually make this possible. Once patients have their information, once they go in front of the right surgeon, is the next obstacle that they have to fight for funding.
So something like an intestinal transplant, because it's so rare, gets centrally funded as opposed to trust by trust, and it is a really worrying time when you go up before a committee that decides whether they're going to fund the surgery. And it basically, they call together leading experts from around the country, not just surgeons, but psychologists, managers, and then they assess each patient's case together. So, for example, in my case, my surgeon felt I needed a bowel and stomach transplant, and actually I got rejected for the stomach. I was told that was too high a risk from a cost perspective, and that there was a good chance that with a new bowel my stomach would work again. So I had an isolated small bowel transplant. My stomach didn't work again. They ended up having follow-up surgery to remove the bottom half of my stomach and effectively replumb me, because at the time we didn't get approval. And yeah, look, those are judgment calls. And I get that, but I think what the healthcare service is not great at doing is looking at the wider impact that major surgeries have. So if you are, at the moment there are 2 centres in the UK that do intestinal transplant, Oxford and Cambridge, which means you can fly in from anywhere and have it there. But how do your family cope? Because you're in hospital for months. Where do they put up? So charities like mine are able to provide funding. So for example, we got access to an old nurse's flat on campus. The charity redecorated it, revitalised it, and it's now a unit that families can live in whilst their loved ones are going through transplant. So I respect the fact that there are not infinite funds for everything, and everything is case by case. But sometimes what is frustrating is they look at the costs of the surgery and not looked at the wider costs that are involved. So on average, a bowel transplant is about £300,000 in funding. That money does not last your lifetime. By the time you've had surgery, which on average is 15 hours, you have a length of stay in hospital. In my case, it was 9 months. Some people are out sooner. You've got ongoing medications and treatment for the rest of your life. Nobody's thinking beyond that surgery.
What would you like to see happening in terms of making this more readily available due to funding to other patients?
So I think a bowel transplant or multivisceral, because often there are other organs associated with the bowel, is a very risky procedure. It's a very high-level procedure, but it's something that the NHS has tremendous skills that they can do in 2 specialist centres. So I don't ever see this as a mass market surgery. However, what they need to do is assess more than the surgery when they look at the funding options, and they need to really be aware of the impact that surgery has beyond the hours on the operating table and the number of days that you have in the bed. And I would like to see greater funds allocated to a wider service around surgeries like transplant. I would like there to be a greater understanding of the impact that going through that surgery has on a patient's life and the family, because there is so much evidence now, even in the small numbers we've done at Oxford, that those patients that are lucky enough to be surrounded by family close by, to have a support mechanism, they recover quicker, they get out of hospital quicker, they get back into ordinary life quicker. And somehow, when we look at funding those, we don't connect those dots. So we think, okay, I'm going to fund this guy for this surgery and that's it. But if you fund in the wider context, so okay, if it means I need to bring wife or partner or husband down to Oxford and there's a flat for them to live in, and then there's support services, there's services in the community, actually you'll save the NHS money because you've looked at it in the round, and at the moment we don't.
If a big corporate or a wealthy individual is listening to this interview and they like to help out, how do they get hold of your charity, and how much money are you looking for over the next 5 years for your charity to help families?
So our charity is Crohns and Colitis in childhood. It's called the 3Cs. Our principal event is called Guts in Motion, which is a charity ride. For the last 5 years, we've raised now £500,000. We raise about 100,000 a year for the charity, and it goes into not just research, but supporting families that go through transplant, generally that come through inflammatory bowel disease route into transplant. So we are looking for funding for two areas. One is directly for research. So there's some interesting work that goes on that when you are diagnosed as a child, perhaps with the inflammatory bowel disease, are you predisposed through genetics, through epigenetics, to potentially be down the line for a transplant? Can we predict that early? And then we put other funds into how do you support the family and the network to enable them to have breathing space. Because if you're going for a transplant of this magnitude, you're not going back to work for at least a year. You need to have that support. And if somebody wants to get involved, they can either do it because they're interested in research and looking down the lines of finding cures and finding new treatments, or because they are prepared to be more of a social giver and support the wider framework. And they can do it through our charity, and they can do it directly with the hospitals.
Could you tell us a little bit about your professional associations as far as e-participation is concerned and driving it?
So I'm privileged. I have had a relatively unique patient journey, but I've at every step of the way been very privileged to be treated by truly amazing individuals. And at 16, I went to see a gastroenterologist who ended up becoming the Queen's gastroenterologist, and he basically said to me at 16, I will only treat you if you take responsibility for your care as well, and we do this as a team, and we're a partnership, and we look after each other. And that's followed through. And when I arrived at Oxford, I had incredibly brave healthcare professionals who responded to all the things that I wanted to do, and that's how my patient participation grew. So two great examples. I would have to travel 90 minutes to see them for a 5-minute routine appointment, and I was like, why can't I just Skype you from my desk? Why do I have to come in? And they went, yeah, okay, you can. And at the first multidisciplinary team meeting that they have every Wednesday morning, surgeon went to connect us in, and everybody else walked out the room, and they're like, you can't talk to a patient on Skype, you can't do it. And the surgeon was like, but he wants to. They didn't do it. He went home, we had the Skype call from his home. 18 months later, Skype clinics have been offered to every patient going through transplant. So that's not me being so dynamic. It's a partnership between the healthcare professional and myself, and them reacting. Another example now, I'm on a WhatsApp group with my healthcare professionals. I get my blood tests WhatsApp back to me. If I've got an issue with a wound, I still have a line in my arm. Take a picture on my phone, I send it to the WhatsApp group, and we communicate very differently. And it's those sort of day-to-day involvements that have led to my patient participation, because I just believe that the principle is it's my body, my data. I'm very happy to hand it over to other people to make me feel better, but I want to be part of every decision that takes place. And I think the more you're involved in your care, actually the better you learn to self-manage, the better educated you become, the more responsibility you take. And I think in a healthcare system at the moment that whichever country you're in is broken and busted, because we are keeping people alive longer. We're coming up with new surgical techniques, new drugs that are amazing. The flip side of that is it's not sustainable financially. So you have to move to a model that prevents things happen rather than treat them once they've happened. And to do that, patients have a responsibility as well, I really believe. And so my whole goal around this patient journey and this e-patient movement is to improve education, to get empowered, to be part of the conversation. And listen, I have to be. I'm dealing with transplant, I'm dealing with cancer, I'm dealing with multiple conditions. I have to be that pain in the arse. Not everybody has to be, but I think for the healthcare system to change, everybody needs to be working together.
Could you tell us a little bit about your retweet service and the other social media accounts that you've set up that drive e-patient to e-patient sharing and also e-patient to doctor sharing, so that anybody listening to this can get involved?
So I'm involved with a number of social media enterprises. Probably the principal one I do is out of Stanford and their Medicine X program, which is a digital health program. It's just about empowering patients. And the principle for me online and social media is sharing information that I think can support another patient or a healthcare professional. And it's just about sharing and open access. And what I'm keen to do as well is, and I think places like Twitter do this really well, they kind of democratize the voice. You can have a conversation with people who wouldn't ordinarily talk to you or answer your email. I'll give you an example. Last week I was at UCLH in London and we were having a discussion about robotic surgery versus open surgery for the gut and what is best for the patient. And all my surgeries have been open, not through robotics, and the team in the room were basically going, we prefer to do open surgery, we think it's better than robotics. That's found its way onto Twitter, and we ended up having a conversation with surgeons from 4 different countries around the world about what is the right thing at the right time. And what came out of it was, everybody had different opinions, but what came out of it was what is right for the patient, and it's connecting the patient with the right surgeon, and at that time you make the decision together. And that's really what retweeting and sharing on social media. I use various hashtags. So hashtag MedX is a big one through Stanford. Hashtag NHSSM, which is the NHS social media strand, which I'm the patient lead on, is a great conversation. Hashtag IBD chat is another one particularly relevant to me, and it's really just designed to share information and support people.
Could you give us any more usernames?
Yeah, I mean, there are plenty of people that you should look at from around the world, I would say.
Specifically the usernames that you're using on social media to drive e-participation.
So my own Twitter handle, which is at MJSears, SERES, Bowel Disease One Global Family, is a great hub on Facebook, particularly if you're in the world of inflammatory bowel disease. I would urge you to go to Stanford Medicine X on Twitter if you are interested in using new technologies in healthcare. What are patients doing? There is a hashtag called We Are Not Waiting, and that is about patient-powered innovations. So people that have, amazing people that have built their own artificial pancreas and diabetes care, or solutions in multiple sclerosis. So, if you want technology, go down one way. If you want to know what's very topical in the NHS at the moment, NHSSM is a great one. But as I said, you can just come to me on Twitter through @MJSears.
How would you compare the e-patient movement, the sharing movement in Europe, with the sharing movement in the States? I believe e-patient Dave started some time ago in the States.
So there's no doubt that people like Dave de Bronkart and others and led the way. There was the creation at the time of something called the Society for Participatory Medicine, and they led the way about how patients can get involved in healthcare. What I think now, if I wind the clock forward to us now, I think that Europe leads the way for patients really, really making a difference. And I think In the States at the moment, you see some amazing isolated examples, and they are much more vocal and they're much louder about what they do. But I think practically on the ground, there are people in Europe doing some amazing things. Sarah Regari, for example, in Scandinavia, who's a Parkinson's patient, she pretty much created the quantified self movement. She tracks all her data through a mobile phone and a smartwatch. She sees a doctor maybe for 15 minutes a year and does everything. The Centre for Patient Leadership, CPL, people like David Gilbert and Mark Doherty really pushed the boat out here in the UK for patient leaders. I think, the NHS Digital Services team really, and the NHS Citizen Programme really pushes patients to the forefront. Alison Cameron and Anya de Jong have been great. So in America, I think you've got isolated patient superstars who are doing amazing stuff. There is Charlie Blockner, who really has raised the profile of gender identity in a huge way from a patient perspective. Emily Kramer-Gollengoff, cystic fibrosis patient. She's been part of President Obama's precision medicine initiative. So I think they get higher profile in the US. We don't possibly get that profile. We don't get access to governmental levels and things like that. But on the ground, we're doing more here than they are in America.
If I can take you back to your medical device company, are you looking for investors?
So you asked me if there's any exclusives. We yesterday formally closed a Series A fundraise, so you get it first.
Thank you very much.
So sorry about that. Hang on cue.
No problem.
So I'm very proud of the fact that the company, 11 Health, has just raised a big Series A round, which will see us open a small office in the US.
Congratulations.
That's exciting. So, but as I have been told on many occasions, you're continually fundraising. So, are we looking for investors? We're trying to build relationships all the time. Yes.
Are you looking for people?
Yes, very much. Now that we have money to hire people, yes, we are. We're looking for engineers, software and hardware engineers. We're looking on the sales front. And we're looking in the regulatory side because our medical device is regulated here in the UK and across Europe with the MHRA, and it's FDA approved in the US. So we're looking, yes, engineers, developers, regulatory and sales.
For the new generation of big idea creators within your field, what would you like to see coming from them in the next, let's say, 15 years?
So I think the future of healthcare is all about the mobile phone. I think everything is about access to data, the right data, and everything now is about preventing rather than reacting to treatment, and it will all come through the mobile. So I think there's a couple of things I'd be looking for the next generation. Number one is I think more education for them around preventing problems happening. What can they do as an individual to prevent issues occurring for them in their lives? I've got 3 teenage kids. I'm conscious about making sure they live their lives as teenagers, but eating a bit better, exercising a bit better, doing things that could potentially prevent things. From a development and technology perspective, or just generally in healthcare, technology is going to play a huge role in healthcare. We are way behind in healthcare where we are on other industries. We are already using artificial intelligence and virtual reality in other spaces, and we're nowhere near it on healthcare. The NHS is still the biggest purchaser of fax machines even today. So I'm looking, what I think the next generation, and I count my kids in that, is they consume their lives on their mobile phone. How do we turn that into healthcare tools that are sustainable? So it's great to count your steps. It's great to create a cultural change that forces people to walk and talk a bit more. But how do we help treat things? How do we use our mobile phone to improve managing chronic conditions. How do we take data off here and put it in a place that our doctors really want to see it, which is not on another app and another dashboard. It's still in the patient record. How do we, at the moment, take USB sticks like this, which contains all my health records, but yet I can't put them into a computer in the NHS. I can take them to America and put it in, but our systems here don't allow for it. So how do the future generation are going to solve those problems? They're going to join those dots far better than we are, because they don't see the barriers in the way we do.
I'd like to take you back to your human story. Do you have any siblings?
I have a sister, yes.
What sort of childhood did you have?
So, my sister and I now are very close. We weren't always close. I think in the teen years, in sort of the 12 to 18-year-old, it was really tough for her. More than me, and I think I look back now and go, we always got on and she's been amazing and whatever, but actually I think it was really hard for her. I spent a lot of that time in hospital. I spent a lot of that time taking up my parents' hours and time and visits, and she didn't get that attention all the time. And I look back now and go, do you know what, I'm lucky that we're as close as we are now, because she never resented it. But it must have been hard for her. It must have been really hard for her. And in a way, there are some parallels now with my own kids, because, I've been ill and unwell. My daughter's first 4 birthday parties were at a hospital bed with me. And I think, what impact is that having on them, or did it have on them? And, in a sense, it's actually easier to be a patient sometimes.
How did you manage to take exams, to study with all of these health challenges?
There were plenty of things were delayed and postponed and taken at odd times. And I went to university to study law and politics. I didn't finish my legal qualification because I was in hospital again. So they were interrupted. I missed a year of school and had to catch up at a college on O-level time. But I think I was lucky that I had teachers and family support that always encouraged me not to miss out, even if things were delayed. So it impacted all the way through my work career. But I just think the easy option is to roll over and do nothing. The harder option is just to get up and keep going. And I think, you have to just keep going.
What do you think it is about you that enables you to stay so positive and so driven? I mean, you have enormous health challenges, but at the same time, you've had an incredible career. You've worked within entertainment. You've launched a wooden toy company. You're now working on ideas which are truly helping to shape the human story in the most positive way. Where does this strength, this motivation, this drive come from? Can you go back to a time when you were a kid when there were possibly hints of it?
I think, look, and listen, there's been plenty of downtimes as well. There are plenty of quiet moments when and the door's shut and the curtains are drawn and you feel what is going on with your life. But I think, do I draw on one? I can't draw on one experience. I think, my dad in particular is a very positive person. He's got a very positive outlook on life. Even in the ups and downs, he always believes he'll come out the other end. And maybe I've inherited a bit of that. But I've always believed that you can do anything you want. And don't get me wrong, as I said, in work, I've had plenty of downs as well as up. It hasn't always been plain sailing. But I think now my biggest motivation is my kids. It's as simple as that. I want to be able to show them that no matter what happens, there's always opportunities, and there's always future, and there's always a way forward. I think I have a duty to show other patients that you can get through things and you can do that. I owe that to my medical team, who, let's be honest, saved my life and continue to do so. I owe it to them, and they always say to me, don't worry about what you can't worry about. Live every day. Come on, you can do it. And I owe it to them. And that's really important to me, that I show them that I can live as best a life as possible. Listen, I support a terrible football team who's never won a trophy in my life, and I still support them. So I think I'm lucky that I think there's always been motivations to get myself going again. And as a kid, I was really into sport. I was lucky enough. I played football and cricket for my school teams, and so my motivation was to get back on the field. I think I've always been able to find some motivations to get myself to do things. And right now, it's very simple. It's about improving the quality of life of patients like me, and it's about providing a future for my kids. Those are the two motivation factors.
When did you start making things? Because you had this toy company.
Yeah, I've always wanted to make stuff, and it's quite interesting because I don't have an engineering or a background in it, but I love the creativity of starting with a blank sheet of paper and building something. So I'm rubbish at the more mathematical, science-driven, and I'm much better at the creative. And I've always thought, even with the wooden toys, it was okay. Here's a license. We could make something that doesn't exist out of it. And I love that creation. I love that ability to be able to go, well, why can't we do this? Or how do we do that? So maybe that just makes up for deficiencies and the fact that I'm rubbish at maths and science and better at creating things.
Is there another field that you would potentially like to go into as a creator in the future?
I think healthcare is a passion now. My life is all around healthcare. I live my life as a patient. I work in it, and I've got more to do in healthcare that I really want to. At the moment, I really believe we can make a difference in this sort of niche area of healthcare, but actually I think patients can make a bigger difference in healthcare in general and transform the way healthcare is delivered, and that's really interesting to me. And I never understand how you can build a solution without really understanding the end user. And in healthcare, we do that all the time. We build solutions to things without thinking about the people that are using it, whether that be the healthcare professional or the patients. And I think we got it upside down, and I'm really interested about how we learn from other sectors and bring that into healthcare.
Which other creators within health, maybe even within the broader market, do you most admire?
So I look right now at other patients like Dana Lewis, who created her own artificial pancreas, and think, wow, that is truly amazing what you've done. Everybody gives you the same answers when it is, but I think I look at someone like Steve Jobs, and I look at the Apples and the Googles, and I think you changed the world, and I think we can do that. Nobody's done it in healthcare yet. Nobody's really transformed it, and I think there's an opportunity for us to do that. So, day to day, I do look at other patients. I look at people like Larry Chu at Stanford Medicine X, how from nothing, he said 5 years ago, patients are the future of healthcare, and I'm going to build a conference and a healthcare movement around patients. They are going to be on the main stage. They're going to be front and centre. And 5 years on, he's built the biggest global healthcare conference in the world, and movement. And I just think, wow, you just got that vision to do things. I wish I had that.
You're off to the States shortly. What are your objectives out there? Are you looking for staff?
Yeah, so we're going to open an office in Southern California. I like the idea of the fact we've got some sunshine. We're going to hire some staff. Yes, we are looking, as I mentioned to you earlier, particularly around engineers at this stage. And we are also looking to close out some really interesting trials with a number of hospitals, the Stanfords, UCLAs and Cedars-Sinai, where we can take data that exists within our app and push it through into the hospital record and really sit and with both patients and clinicians and sort of shape our product a bit more. So I'm looking forward to doing that.
If any of the opinion leaders that you're targeting within the US are listening to this interview, what would you like to say to them?
I think the message is very simple in healthcare, and I mentioned it to you earlier. You can't ever build anything without people like us in the room who are going to be dealing with those. And I think if you've had the experience of going, of managing long-term conditions for a long period of time, all I would say to you is invite us in, we should be part of that collaborative that is going to shape the future of healthcare. And it's not about a rant, it's not about a criticism, it's about a collaborative approach. The future of healthcare is everybody working together, and at the moment most people do work together and the patients are not in that room. So I would say invite us in, because it will be amazing what you'll find you can get out of it. Truly amazing.
Are you mentoring anyone at the moment?
I'm mentoring a lovely girl who was born with a heart defect in the UK, and she's building an app that is helping to teenagers who transition out of, if you like, paediatric care into adult care. And it's a very difficult time, and she's doing some work in that, and I'm mentoring her there. I'm privileged as well at Medicine X to be their patient in residence, and I'm helping 2 or 3 patients in their early stages of development with their innovations. But anybody wants some help, come contact me. Absolutely, that's part of my joy, is to be able to share my experiences and help some other people. And as I said, I owe it to my team that look after me every day to be able to give back. So if anybody is watching this, contact me.
Do you have a final message for the new generation of creators coming up in the world?
I would say this is an amazingly exciting time to be out there. There are no boundaries. The only boundary is your imagination and how wide you can take things. So just start. As I think that's all I did, was just start and see where it goes, and believe in yourself, and people will start to believe in you. So don't think about it, just do it, and you'll be amazed about how far you can get.
Michael Serres, it's been an inspiration and a privilege talking to you.
It's been a pleasure to talk to you.
Thank you very much for your time.
Thank you.